It's great pleasure to have Professor Soumya Swaminathan give the next talk. She needs no introduction. Briefly, as you know, she has been with NIRT as the director of National Institute of Research in Tuberculosis in Chennai. Subsequently, she has been the head of ICMR. She was till recently chief of World Health, chief scientist at the World Health Organization, and since January this year, she is also the chairperson of MSSRF, which is down the road. She was not feeling well, but still agreed to join from within Chennai. So we are grateful to Professor Soumya Swaminathan to give this talk. Thanks for kindly agreeing to give the talk, and we look forward to your talk.
Thank you. And good evening, everyone. It's very nice to see all of you. And thank you very much for this invitation from the Institute of Math Science and best wishes and congratulations on the centenary celebrations that are ongoing. What I thought I would do is to touch upon the topic of climate change, public health, and equity. And the reason that I wanted to do that and also build some comparisons between what happened during the COVID pandemic, our experiences at that time, and what I feel are some of the similarities, both in the root causes as well as in the kind of responses that we need to address these issues. Basically, both the pandemic and climate change are things which are global in terms of the phenomenon. And therefore, they impact people all over the world. And national boundaries really do not play much of a role. And therefore, if you really think about how these need to be tackled or addressed, again, a country by country response may not be the best way, even though every country does have to do its bit. For example, during the pandemic, every country had to put in place systems, mechanisms. They had to roll out programs. They had to communicate to the public. They had to make available the necessary supplies. They had to look at what new technologies were needed. There was imports and exports involved. There was a lot of behavior change communication that was needed. But at the global level, there was also a lot needed to be done. And this was, for example, the international health regulations, which are supposed to be binding regulations. They're the only ones that exist, really, which describe what countries should be doing when there is an outbreak, and mainly talking about infectious disease outbreaks, because so far, the WHO has something called a public health emergency of international concern. And these are, a call is made that something is a public health emergency if it is something that's sudden in nature, it's unusual occurrence. Of course, it's infectious and therefore it can spread rapidly and have cross-boundary implications, and that there needs to be a globally coordinated response. So if you look at what constitutes a public health emergency of international concern, essentially we've had polio, for example, on that list. We've had Ebola, we've had the SARS-1, the SARS-2, as well as Zika. So there have been 6 such declarations by the WHO. Now, the WHO has never declared a non-communicable disease as a public health emergency. And I think some of us feel, and we could all argue, that the impacts of climate change, on health would constitute a public health emergency. If you look at the statistics, and I'll come to some of that in a little bit, but the increasing number of deaths due to heat, for example, the number of people who are being impacted, has tremendously increased, not just in Africa and Asia, but in Europe as well. And it's projected to increase even further. Of course, we're seeing the impact of the floods right here in Chennai. This is also was considered to be a once in a 100-year event when it happened in 2015. And in 2023, 8 years later, we're seeing a similar event occur. And similarly, there have been, all over the world, very unusual climatic events, whether they are, massive forest fires or whether they are hurricanes, cyclones, or floods, or the other extreme, which is droughts, which is actually driving millions of people, particularly if you look at what's happening in the Horn of Africa, if you look at what's happening in Western Africa, but also what's projected to happen in some parts of India, that it's going to be too dry and there isn't going to be enough water for agriculture. This in turn will lead to climate migrants. So I think the implications of climate change are similar to the global implications of a pandemic, which really disrupts human life. And of course, it disrupts the economy in a very big way. If you look at the global governance, we were talking about the international health regulations for handling emergencies. But actually, if you saw during the COVID pandemic, that it was not that all countries were following the international health regulations as laid out in the book. And there were some reasons for that. For example, it starts by saying that, you need to share your data very openly, transparently, and quickly. And in fact, I think it's 48 hours or 72 hours, you have to report to the WHO if you find one of the pathogens that are either on that list, which have to be reported, or a new organism or a new pathogen or a suspicious new occurrence, it has to be reported. Similarly, there are rules about sharing of data and samples, and also about travel and trade regulations. And generally, the rules talk about not bringing in travel and trade regulations unless absolutely essential, unless it's for a specific period, for a certain period of time, and unless it can be justified. So, for example, during the pandemic, we saw that whenever there was a new variant, for example, of course, in the beginning itself, many countries had stopped all flights from China, as soon as people became aware that there was something going on. So that was one of the early actions that were taken. But again, it was too late in the sense that the infectious pathogen, a virus or a bacteria or a fungus, can travel much faster. Today, in this day and age, when we are globally connected, and when there are millions of people who are crisscrossing the globe, before one can actually recognize that there is something going on, most likely the pathogen has already spread. And therefore, sort of closing borders and things like that has less of an impact. But it could be justified that you do that if it is possible to contain an infection. For example, for SARS-1, within a matter of 9 or 10 months, the infection had been contained globally, despite the fact that it had spread to at least a dozen countries. And that was possible because of the way in which it spread, which was basically through very close human contact, through body fluids in people who were already very ill. And so it was relatively easy to identify those people, isolate them, quarantine the contacts, use infection control procedures, and that way you could actually contain the spread. The difference with SARS-2 was that the transmission was occurring even from asymptomatic people, and therefore it became almost impossible to contain. And so the infection was everywhere before you knew it, and there was no way that isolating the sick people was stopping the transmission. So even though we did focus a lot, especially initially, on isolating the infected individuals once they were identified, tracing the contacts, etc., there were clearly lots of people around who were infectious, who were infecting others. And with every evolution of the variant, the transmissibility of the virus increased. So by the time we got Omicron, it was so transmissible that even the most stringent control measures were it was not possible. So the point that I was making was that when Omicron was first detected in southern Africa, it was in South Africa and across the border in Botswana and Namibia. And the scientists there actually worked extremely fast along with the clinicians and identified the new mutations that had occurred and reported to the WHO that they had identified a new variant with a large number of mutations. And very quickly, the WHO committee had classified it as a variant of concern. All this happened within 3 weeks of the identification of the first cluster in South Africa. So kudos to the scientists who did that. But the immediate reaction of many countries, particularly high-income countries in Europe and North America, was to close their borders, to stop all flights coming in from those 3 or 4 countries in Southern Africa. Tourists were stranded, trade was halted, flights had stopped, people were put to tremendous inconvenience, supplies were not coming in. And as a result, the economy of these countries took a real battering. And all the time, WHO, we were saying it is pointless, actually, to put in those kind of restrictions because this virus would have already gone around the world. It's a matter of weeks before you start seeing Omicron, gaining its foothold across the world. And that's exactly what happened. In a month or two, the entire world was reporting Omicron as a dominant variant. So what it did do, though, was, and this was not a reverse situation in the sense that the low-income countries were not putting, these kind of travel and trade bans on high-income countries. When, for example, the first alpha variant was reported from the UK, that reaction was not there. But because it was reported from Africa, probably that, reaction occurred. So despite the international health regulations and despite WHO clearly giving advice to the contrary. So I think the international governance of things like pandemics and climate change, and we've just come out of the latest COP28, which most observers have said, was really not much progress, except for the fact that, yes, the word fossil fuel was used in the final declaration or statement, but the wording was also weak, that it left a lot to countries to decide exactly what they wanted to do or what they did not want to do. The other thing that was quite was new at this COP was, for the first time, there was a health day. And all of these years, despite the fact that health professionals, the WHO and others have been saying that health is absolutely critical in terms of the impacts of climate change. It's not just about the natural disasters that are occurring or the fact that species are becoming extinct. Of course, all of that is extremely important. But the fact is that human health, our very survival is at stake. And so it is surprising that this was never considered important enough to be discussed. In fact, neither was agriculture. And so I think for the first time in this COP, there were sessions, days dedicated to agriculture, food systems, to health, and some joint declarations that were signed by over 130 countries. Interestingly, India did not sign up to the joint declaration on climate and health. I'm not sure of the reasons why, but basically it was a general declaration saying, we recognize that this is happening, that there are very severe impacts, that we have to take action, but we also have to decarbonize the health system. Because health system overall, if you look at the health system or health facilities all over the world and add up their carbon emissions, it's estimated to be about close to 5%. So it's significant. And if you look at the entire carbon footprint of the health system, which includes supply chains, if you look at food, and if you look at the way that, things are moved around and procured, then actually, the footprint is quite high. And so far, no one has really thought about these issues. Hospital administrators certainly are not thinking about environmental sustainability as a key priority for them, when they are making decisions about supply chains, procurements, or in fact their energy supplies, etc. But again, the climate issue works both ways. So health systems are contributing. There is a carbon footprint there, significant one, and at the same time they suffer because we know that, for example, when the floods happen in any city, like they happened in Chennai, electricity is out. Even generators get submerged. And the last time we had floods in Chennai, very unfortunate that several people who were on ventilators in one particular private hospital actually died because the generator got submerged and suddenly the electricity went off. So the ventilator stopped working. So such disasters happen, but also we know that 50% of the world's health facilities, and these are mostly across rural areas in Africa, Asia, Latin America, 50% do not have electricity and they do not have running water. So you can imagine what quality of care will be provided in these places without running water and electricity. So it's a good opportunity to use renewable energy like solar, which will not only be good for the environment, but will supply these centers, but also build, when new health centers are being designed or they are being retrofitted, we need to make them climate resilient. If you're in a low-lying area, then ideally the health center, the hospital should not be sitting in a place where it can be easily flooded. Or if it's an earthquake-prone area, we need to think about where to place it and how it's designed. If you are in an area with which is susceptible to heat waves, then we need to think about what facilities that health center needs in order to deal with patients who may come in with heat exposure and heat stroke. So I think we need to think much more about the design of our health facilities, make them climate proof or climate resilient, but also think about how they also are, as far as possible, the design is also environmentally sustainable and environmentally friendly. Now, the global governance of climate change, we've seen that there are these IPCC reports, etc., but and the COPs which take place, and then we have certain nationally determined contributions that have to be set, commitments have to be made by each country. And I think for the first time we had a global stock take, which looked at where countries are, how they're performing. And it's clear that if you add up all of this, that we are not going to keep the 1.5 degrees target that was set in Paris, that we're already on track to be somewhere between 2.5 and 2.9 degrees above pre-industrial levels, which has already caused many tipping points to have been crossed. And once you have those tipping points crossed, then obviously you're going to expect more disasters. So I think the focus so far has been on mitigation, and it's important to keep doing that. And clearly mitigation is going to be extremely important, but so is adaptation. And particularly, I think for us in India, we are going to be facing many of the different impacts of climate change. We're going to see heat, prolonged heat, heat with humidity, especially in coastal areas like where we are in Chennai. We're going to see sea level rise. It's projected that cities like Chennai, Mumbai, etc., could disappear by 2100 because the sea is expected to rise by a meter by then. And we're going to see impacts on agriculture, which we already saw in the last couple of years, that unseasonal heat, but also unseasonal rain will damage crops. And therefore your crop yields could go down, and certain crops are more susceptible to damage than others. And therefore our food systems will be impacted, and nutrition will be impacted. In addition, there's the risk of vector-borne diseases. Malaria mosquitoes are now able to live in places where they could not survive earlier because of the rising temperatures. For example, you can see them at higher and higher elevations. Similarly, the Aedes mosquito that transmits dengue is also now able to survive much better in urban environments. It's completely adapted itself. And dengue is probably the infectious disease that is showing the highest increase, particularly across the developing world. And it causes a lot of morbidity, some mortality, but a lot of morbidity, a lot of work days lost. So, all in all, I think the impacts of climate change on health are going to result in reduced productivity, more ill health, and certainly higher cost, both in terms of direct healthcare expenses, but also economic costs due to reduced productivity of humans, as well as the destruction of infrastructure. So, how do we really think about then these issues of climate change and public health? And I want to mention the word equity here as well, because again, that was one of the lessons of the pandemic, or I could say one of the sad aspects of the pandemic was that we did see huge amounts of inequity across the world, but also within countries in terms of access to healthcare, in terms of access to oxygen, in terms of access to personal protective equipment, and of course, also an access to drugs, vaccines, diagnostics, etc. So some countries in Africa, for example, had no access to diagnostics. So they really didn't know how much COVID they had. And it was only much, much later in the pandemic that they even started testing. There were only 2 labs on the continent that could do PCRs at the beginning of 2020. Genomic surveillance really picked up during the pandemic. In fact, that was one of the, I think, technologies or tools that gained so much of, that received so much attention and so much focus and so much investment as well. And today, of course, we have a lot more centers that are capable of doing genomic sequencing, doing wastewater surveillance, etc. I think that the real issue is how do you do surveillance? What do you do surveillance of? When, how, who should do it, and how should it be used? How should the data be used by public health authorities? One of the issues was really about access to, not just access to data, but really access to data in real time. Because in an emergency, you need to act in real time. It's not an academic exercise. And most of our centers are used to doing surveillance as an academic exercise, where you collect a lot of data and then you analyze and write it up as a paper later. But in the case of rapidly moving phenomenon like a pandemic or an epidemic, even if it's a localized one like the Nipah virus in Kerala, for example, or if it is, let's say, something to do with climate, where it may be a flood disaster with its own complications, or heat, you want to know on a day-to-day basis what is happening. You need to be able to monitor, and you need to be able to predict a little bit what's happening into the future, and you need to be able to act on it and make decisions based on it. So I think that the whole way in which we handle data, and at the city level, at the state level, at the country level, and then of course it will go up into the global level if needed. If it is an international event, then it needs to flow up there. But unless it starts from the bottom, we're not going to have that. So I think one of the key areas to work on really is how do we network our centers which have these kind of capabilities. And again, you need capacity to analyze. So we do have now, I think, infrastructure in place. You have sequencers, it's still expensive, but you have the reagents, you have the trained technicians who can run the samples. I think it's at the other end, the bioinformaticians and the data scientists who know what the questions are, who can understand and ask the right questions, analyze, and then provide that kind of analytics, is where I think we still have a gap, despite the fact that we have so many excellent centers of mathematics, of bioinformatics, of data science. That and the link with public health, I think, needs to be strengthened. Similarly, I think in the area of climate, it's clearly an interdisciplinary kind of work that is needed, whether it is research or whether it's action. You need people who know how to analyze, the data from the meteorological stations, which are getting better and better. Their predictions are getting more and more accurate. But what you need again is not only the longer term, but you need the day-to-day predictions, which can actually immediately inform people on what they should do. So if you're expecting um, a heat wave, then you need to have some kind of a advisory for people on, maybe a red, orange, and green type of system, where if once you get to an orange, or certainly if you're in a red zone, just like it's done for air pollution, and the graph which has been developed around the different levels of cutoff, where automatically certain actions come into play. We've seen in Delhi, for example, schools being closed whenever the AQI goes above a certain level. There are traffic restrictions, there are construction restrictions. So similarly, I think for heat, one is going to have to put in place such a system. Otherwise, you're going to see heat-related mortality occurring. So I think the governance there are heat action plans that have been developed by states, by cities. But I think it's really on the implementation side where you need a multi-sectoral approach, just like was done during the pandemic. You had so many ministries working together, because clearly it was not just the health ministry that needs to act. There were actions that were required across the board. And so there were empowered groups of secretaries set up. There were many committees, there were clearly defined responsibilities, there were actions that were taken across the board for climate adaptation as well as mitigation. You need to have those kind of mechanisms in place. The governance has to be very clear, institutional responsibilities, the reporting lines. And again, decentralized decision making is going to be important. And we saw that also during the pandemic, that too centralized decision making can often delay what needs to happen, locally, where whether that's going to happen at the district level or even below that, one needs to, because again, there's so much variability that it's very hard for a large country like India for us to really have some kind of centralized decision making, because one part of the country could be suffering from floods, the other part could be suffering from drought at the same time. One side is having a heat wave and the other side is having something else. So we need protocols in place to address all of these, but you also need the governance and you need the financing and you need the clear-cut responsibilities. Also, I think for the future planning, one really needs to, again, work in a multi-sectoral way, where if we're looking at the next planning for the next 25 years, let's say, then you've got to look at, I believe that one needs to look at the impacts of decisions taken across different ministries on health. Because ultimately we know that, if we don't pay attention to our health, that's going to impact everything else. If your health is not good, your productivity is not going to be good, and economic growth will not occur at the same speed at which you want to. So there's still a lot, I think, that's to be still uncovered in terms of research that's needed. But there is already, we know enough to take action. One good example is, I think, air pollution. And the links between the two are obviously, if you look at the upstream determinants and the drivers of climate change, which is largely due to fossil fuel, of course, some of it comes from agriculture as well, then it's the same fossil fuel use and burning that's resulting in air pollution. Whether it's from the industrial sector, transport sector, construction sector, agriculture, these are the main contributors to air pollution. It has been proposed that, an airshed approach be used, particularly for cities where the pollution is coming from within the city, but also could be from the surrounding areas, and an analysis be done, apportionment be done, and then you address those. So if we start really focusing on, the fossil fuel issue, which is what is driving climate change, it's also contributing to air pollution. And again, the impact of air pollution on people's health, I think, is underappreciated. It is not only the lungs and not only people who have asthma, but it's the small particles, the PM 2.5, is impacting cardiovascular health. It's impacting brain health. It's causing an increase in diabetes. It's basically creating a pro-inflammatory environment, which impacts on all of our organ systems. Of course, pregnant women, young children, and the elderly are particularly vulnerable, but really there's nobody who is safe from the effects of air pollution. So it is one of those issues, and it's been shown in other places in the world that if you clean up your air, it has massive and immediate health benefits. You can quantitate the reduction in admissions due to heart attacks, for example. So, so some of the upstream drivers of air pollution, climate change are common, and at the same time, the co-benefits of addressing these are massive. So the co-benefits for health and the environment, from having better urban transport systems, from having better pavements and cycle lanes, encouraging people to walk or take public transport, having green spaces where people can exercise. Physical inactivity is one of the biggest risks today for health. And it's also good for mental health, but it's also good for the environment and the food system, moving away from highly ultra-processed foods to more locally sourced, fresh food, particularly through our public distribution systems, the PDS, the school meals, the Anganwadis, is where you can intervene and have a very big impact. And we know from all of the nutrition data that is collected in surveys that we still have a high burden of both undernutrition as well as a growing burden of overnutrition, obesity, as well as a high degree of anemia, particularly in women and children. So our food systems are clearly not, while they are providing food security for sure, but not nutrition security for the majority of our population. So I think that's again an area where there could be co-benefits for the environment. For example, millets is a good example of a crop that is considered to be climate smart because it requires less intense water as well as fertilizer use. And it is very rich in micronutrients, in addition to some of them having higher protein than wheat and rice. But basically the difference is with the micronutrients. So incorporating more lentils, incorporating more fresh fruits and vegetables is what is needed to improve dietary diversity. And again, that all of those things could be easily done in a way that provides these co-benefits. Obviously, there's, investment will be needed. But more than that, it's going to require some good degree of planning and, again, working of the intersectoral collaboration and a joint plan of action, looking ahead. And I would say keeping health at the center of, of all the policies. So I'm not sure. I think I have probably taken up the time that was allotted. So I will stop here, but I'm happy to take comments and questions. And once again, I'd like to thank the organizers very much for giving me this opportunity. Thank you.
Thank you, Professor Swaminathan, for touching upon several important issues, including environment, lifestyle, climate change, health, even food security and agriculture. These are very pertinent questions, immediate questions for a country like us should think about and ponder about. Before I open questions to the audience, I had a particular question to ask. I've been wondering if there is any solid research survey data which is available in terms of a scientific publication about the level of public awareness with respect to environmental impact on health. In particular, I'm wondering, is there more or less awareness or sensitization amongst the public about the impact environmental pollution in particular and environment can have on health? across the strata of society, let's say in the developing world versus the developed world?
Yeah, I think that's a very good question, and it's a coincidence perhaps that I just came across this survey that was done by the Mint magazine, along in collaboration with a few other groups, Sambodhi and Development Intelligence Unit. And they found that the majority of Indians agreed to feeling some climate change in recent decades. So, except for about 4 or 5% of Indians, the rest said, it has changed a lot, the climate, and some of them said it's changed somewhat. So, a little higher among men than women and higher in urban than rural. And when asked what were the signs of climate change, they said basically hotter, longer summers and heavy rain. These were the two major factors, but some of them also said spreading of air and waterborne diseases, repeated droughts, and so on, but less of them. Then, when they were asked about sustainable living, 74% of urban and 55% of rural respondents were aware of either climate change or global warming. Most got their information from television, and about 43% had sought information independently. And the survey found that awareness was critical to influencing eco-friendly behavior. A large majority, over 90% of people in urban and rural areas, said they tried to reduce water wastage. They carry their own bags to buy groceries, energy efficient appliances. And those who were aware of the term climate change, they engaged in 6 out of 11 eco-friendly activities, and the rest picked, less, about 5. The majority of people saw deforestation as a top reason for environmental degradation, and the next reasons were exponential growth of vehicles and industrial pollution. Those were considered the main causes. And then accountability versus responsibility. I think many people felt that, yes, action is needed, and that individual action is needed, but that they felt that the government has to do much more. And some of them felt that it is inevitable. About half of the respondents said environmental damage is inevitable in a growing economy, and even our best efforts cannot stop it. And 44% said that India has more pressing issues than climate change. Developed nations have caused it, so they should fix it. And about half of them said it's too early to say that climate change is serious. So I think that this is quite interesting, your question, as well as this survey that I just saw. But it shows that, while people are aware, they've heard the terms, I think the understanding is not yet there. And even among policymakers, I think that, I'm not sure, maybe we should do a similar survey among policymakers to see, how many of them recognize it and how many of them want to or are ensuring that when they make some policy, they're actually considering these issues. I mean, I think Tamil Nadu is one of the few states that has a climate mission. There is a governing council. So that's the first step. But that's only the first step, because there will be many recommendations, and then those will have to be implemented. And, not all of them may be sort of very acceptable to politicians.
The floor is now open for further questions, if there are any. If not, let's thank Professor Swaminathan. There is a special book from Professor Krishna Swami Aladi, the Aladi Diary, which is meant for you. I promise to leave that with Ms. Dilara in next week for you.
Thank you.
Thank you,
Thank you
Professor
very much.
Thank you, Professor Swaminathan, for joining and sharing your deep thoughts with us. Thank you again. We look forward to having you soon in the institute again. Okay.